it is safe to say that welcome to the part 3 of this video, because this topic is extensive. We cannot exhaust them in one day or in one episode. So let's call this episode 3. And as you already know, this is Awoko Kodagadu, a mental health nurse in Ghana, who I went to high school with, Ula Girls, a premier girls' school in the Volta region of Ghana. And you see me smiling because all the questions I had in mind for you, you actually touch on the questions before I even get to them. I said to you that you should remind me to ask you 2 questions. You've already answered one of the questions.
Oh, so, really?
Yes, you've already answered one of the questions. That's okay. I love that. So I have one question for you, and it's going to be a yes and no. And depending on what you say, then I would give you my double question. So does mental health nurses, do mental health nurses fall under Nurses and Midwife Council? Yes or no? Then I'll ask you my double questions that I've had for you since.
Yes, mental health nurses fall under Nursing and Midwifery Council.
Okay. So now my 2 questions. You've already taken part of the first one. You have a platform. This video is going to go far. If you have to make an appeal to Ghana Nurses and Midwife Council in terms of mental health nursing, if you have to make an appeal, a request to them, what will be your topmost appeal? Number 2, if you have to make an appeal to the Ghana government to come to the aid of mental health nursing in Ghana or mental health in general in Ghana, what questions do you have for these 2 bodies? Because you need a lot of help. So use this platform to make your request, because I know this video will go far. We have those links, trust me.
Okay, for NMC Ghana, I know they regulate the training and certification of all nurses in Ghana, including mental health nurses, and they are doing extremely well. You know, the number of mental health nurses that are coming, they are doing very well. The only thing I want to appeal, not only for mental health nurses, but all nurses, is that the necessary things that nurses have to work with, they should always try their best. You know, they are doing well now. NMC is doing extremely well. I don't have much to ask from them. They do well. The training, the regulations, and all that, they are doing so well. Just that I just want to say the students should have a feel of what should be able to more of career training or opportunities should be made available to students, so that by the time I'm finishing nursing, I know what next I have to do. I don't have to finish school before I'll be thinking of what will I do, what will I do, what will I do. Because in nursing, we know there are a lot of career progression and all that. So if this can be added more, it would help the students. And then for the government, I know the government is doing its bit, but a lot still have to go into mental health delivery in Ghana. A lot. When it comes to human resource, when it comes especially nurses, the state of healthcare delivery, our patients, the facilities. We know that the government is doing a lot, but we still need more to be done. If we need to achieve what other the Western world is achieving, we have to put in more. And I believe if mental health is given priority in this country, it will change the face of so many things. It will change the face of a lot of things in this country, and Ghana will be a better country than it is now. It's because we don't give priority to mental health.
You've said it all. Mental health is a core of a being. The person has to be sane to be able to go to work and be productive. And through being productive, there'll be economic resources and all that. So what is the cost of mental health? Is mental health free? If I bring my grandma who is acting a little bit off, if I bring her, am I going to pay for the medications? And do you have a follow-up system? After my grandma comes back home with me, do you come to my house to follow up? Because we have that somewhere else and it's lovely to watch.
You know, mental health care used to be free. Let me put it like that. That was before the introduction of the health insurance. Mental health used to be free. Government used to subsidize or provide for everything. But as time went on, that support was no longer coming. And the facilities taking care of these clients was becoming a difficult task. So now most of the hospitals depend on what they get to take care of most of these patients. There was a time they did Free the Street or Set the Captives Free. It is a program that Mental Health Authority did, whereby all those clients we used to see on the street, they'll bring all of them throughout the country to the mental health facility to be taken care of. The question is, who cares for their bills? And as they come in, it's not only the mental condition you are going to care for. They must eat, their feeding, their physical need, other therapies. Okay, so these facilities now have to charge the client for the care they render to them. And for my facility, it's expensive. At least if you are coming and you need to be on admission for 2 weeks, you need at least a minimum of a day. I know a day is 100 cedis for you to be on admission. So just imagine, if you don't have it, how do you assess the care? Okay, mental health now is expensive. That's for my facility. So we plead with government if something can be done about it. Because we at times you see that the state in which the client comes, this client cannot go home. The patient needs observation, the patient needs to be detained. But immediately they hear of the bill or they hear of the care, like the amount they will have to pay before they are taken care of, it becomes a big issue. It becomes a big issue. So I just want to plead for the medical bills. Government should do something about it. We think it's for us, especially mental health. Government should do something about it. So roughly, if your relative is coming, just you do the calculation. A day is 100 cedis. So just multiply it.
The stigma alone,
it's not easy. It's not easy.
No, yeah. The stigma alone will push people away. And now on top of that, we have the cost, which will push people further away. And by the time this person decides to come finally, they would have gone, the condition would have become worse with time. Yes, that's how we see a lot of people on the streets. Because if I'm coming to pay 100 cedi, mental health is supposed to be free. I just pray and hope that one day we'll get there. So how people tend to send their family members, friends, loved ones to prayer camps and shrines and all that to seek help. Is it still happening? And do they come from there at the end of the day from the shrines and camps and whatever to the hospitals? Are you able to bridge that gap and let them know that, fine, you can pray, but alongside you need medicine to combine to have a full effect? How are you tackling that in the society? Do you have programs to outreaches you do, educate people in the community and say that not everything is about going to a shrine and getting tired and beating, they are trying to beat the devil out of you?
Yeah, okay. So, for you to be able to deliver care to people, their culture and religious aspects need to be considered. And I always say that as Africans or as Ghanaians, we hold very strong belief to our religion or our culture perspective, and mental healthness is not an illness that is excluded from being caused by spirits, by witches and all that. So the idea, because they perceive mental illness to be caused by spirits, the first point of care is seeking spiritual help. A lot of education is going on now. I know Mental Health Authority now has liaised with this herbal camps, spiritual or prayer camps that they educate them. If people bring people there, what they are trained, so that when they go there, because first you go to this prayer camp, the person is tired, is flogged, and all that. But most of these people are being given education. They are being taught, and the knowledge is being brought that mental health illness is not just about spirituality, but it's about a disease process which is treatable or which is manageable, depending on what the cause is. So most of these prayer camps, people still go there, one, based on where they are coming from or based on their backgrounds. But I know Mental Health Authority is doing a lot in that area, liaising with communities, liaising with opinion leaders to bridge that gap of mishandling mental health patients. So I know a lot of the camps now, even some mental health prescribers go there, and then they assess the people who are there. They tell the providers there what to do and how to care for them. So some of them are no longer maltreating the clients as they used to, or abuse the patient as they used to. If there are still some maybe in remote areas, but in our cities now, and most of the is difficult. Yeah.
Thank you. So I have a lot of questions, and I'm trying to summarize it. We're only going to end it on episode 3. So I will talk about career progression for a mental health nurse. You tell me a little bit about what you know. And I had a question before, and having a little bit thought block, but the question is going to come. Do we have enough psychiatrists or psychologists? Do we have a counseling center in our schools, high schools, colleges, universities? Do we have a place somebody can walk to? Or do you have an online service if you want to talk to a counselor or a therapist? Do we have them in our churches?
Okay. Yeah, I know most schools in Ghana now have a psychology department, or I remember when I came to NTC, we had a psychologist. The school had a psychologist that if you have any problem or issue, you just walk to the person and then he will counsel you and help you out. And for our hospitals too, we have the psychologist. For the psychiatrist, you know, mental health is not area in Ghana that fetches a lot. And the psychiatrists, they are not as many as we want to have them. There are still not many, very few that they're in the system. Okay, but then our schools, now we have a lot of nurses. We have a lot of nurses who help, or are school nurses who help with treating children or school children with any physical condition. So if the child is having or exhibiting any stress, psychological stress, they're able to refer the child to a hospital. Then the child is well taken care of. But for our colleges and then our secondary schools, I know most of them have the psychologists and counselors that help them to deal with that.
And I think the churches also do have some, right?
Yes, the churches, and I know now most churches have what they call health support systems. Like for my church like this, we have what we call health team, made up of all health, all members who are health workers, who, if you have any issue, just come to us, we assess your situation and then refer you appropriately. So the churches too are now helping when it comes to that. I can't talk for the few that I can talk for that one.
I like that idea, especially in our setting, in our environments, everything we run to the church first. And we have millions of churches around just one neighborhood. So if every church has that kind of group or society of nurses or healthcare workers that can assess your situation and refer appropriately, that would be a good idea. The churches are more than the mental health facilities. So the churches have to play their role as well to get people the help they need. I know the churches have a counseling section. I know I'm a Catholic, I go to a Catholic church. I know we have a counseling section where you can go and talk to a counselor, a professional counselor, who would help you and refer you if if you need some help somewhere else. So you mentioned that you have a substance abuse unit or department. Is this something? Okay, you have a, okay, I would like you to talk briefly about that. And do you have anything like Alcohol Anonymous? Do you deal with the substance? Do you deal with maybe alcoholism as well? Do the young people come there to say, I have this drug issue, I'm using cocaine, I'm using heroin, I need help to stop? Or do you go to the community to find them? How does that work? Or they come in themselves?
Okay, so as I said earlier, most of the clients who come, their relatives bring them. Someone who is abusing drugs, maybe 1 out of 100 will accept that I'm abusing drugs and I need help. So their families bring them, and when you are brought, we do the necessary assessment and care that we have to do for you, and then you are admitted to do the rehab program. It's a whole program on its own. I haven't worked there much, but I know that it's a whole program that entails a lot. They have various groups. They have, depending on the substance you're abusing, whether alcohol, whether cocaine, heroin, or any other substance. Okay, they have various groups that support groups, people who are there, who have been gone through the program and it has been helpful, who have recovered. Okay, they have all that. I know they have Alcohol Anonymous group, and then the substance, the other substances too. It's a whole program that is on its own. I haven't worked there for months, so I can't give. And we even have two. We have what we call the mini rehab, and when we have the main rehab. The mini rehab, we have up to a minimum of 3 months to do the program. So the anonymous one, they have various groups that support them. Okay, but for the main rehab, is a whole program. Let me just put it like that. I don't have much idea about that, but by the time it takes 6 months to 1 year for you to do the main rehab program, and then the mini rehab one is up to 3 months. That's what I can say about that.
Okay, thank you very much. You have been very informative. You shared a lot with us. So we'll definitely have to bring you back on the hot seat to enlighten us more about mental health nursing in Ghana. So career progression for a mental health nurse. So you finished nurses training college and you became you got a diploma out of that. And can you only work in a mental health facility as a mental health nurse? If that is yes or no, just take that quickly. And the career progression, if you want to get a degree, what do you have to do? Do you have master's, PhD courses available in Ghana in mental health?
Yes, so mental health nurses work in every sector. As I told you earlier, we are polyvalent nurses. So we work in the general, when you go to general hospitals, at times some of the nurses, the mental health nurses work on the general wards. And then I know mental health nurses even work in cardio, and then emergency units. And we work in almost every aspect of health delivery. Yes, we work in every aspect of health delivery. And career progression, mental health nurses can do any other thing they want to do, just like any other nurse. After your diploma certificate, you can apply to go and do physician assistant. You can apply to go and do degree nursing. You can apply to go and do psychology. And you can, any other field you want to work. And you can go and do specialization nursing, like anesthesia. You can do eye nursing and all that. The only thing I know for now, mental health nurses are not being taken is ENT, but I'll find out more about that. Only ENT, but all the other specialization, mental health nurses are doing it.
Okay, so what if you decide to remain in the mental health line? Can you get your degree in mental health, get master's, get PhD? Do we have that pathway in Ghana?
Yes, so mental health nurse, after your diploma, if you want to do mental health first degree, now I'm now a student of University of Ghana doing mental health nursing as my first degree. University of Ghana now allows you to trend the path which you came with. If you're a general nurse, you do adult nursing. Mental health nurse, you do BSc mental health nursing. Community nurse, you do BSc community nurse. So I'm now doing BSc mental health nursing. So we have a lot of career opportunities for mental health nurses, depending on what you want to do. If you still want to continue in mental health, you can still do that.
Thank you very much for coming on the show. My name is Priscilla Kuma, and you are Awo Koko Dagadu, and you have said a lot about mental health nursing in Ghana. And this is like an eye-opener. We are all enlightened, and hope to bring you back for us to talk more and take maybe 1 or 2 diagnoses. Maybe we'll take depression, because so many people are suffering depression nowadays. It's a topic we have to digest for like a good hour. So hopefully we see you back on the channel. Thank you, my viewers, for watching this video, and I'll see you in my next video. Take care and love yourself, and always remember to seek help. And remember that Pantang doesn't only attend to mental cases, but they have ENT, eye, drug issues, substance abuse, obstetric and gynecology, and many other things. We just have to make sure that we project, educate everybody so that they know what to do at the point that they need the help. Thank you and bye-bye.